Hi, so my name is Iona. I am a doctor. I work in the NHS, and right now I'm working in a hospital who is preparing for the COVID-19 pandemic. And I just want to start this post with a statement, and that statement is, I do not fear COVID-19. I don't fear coronavirus. And then I want to go on and just kind of explain a little bit where that statement comes from and why I think it's really, really important to make that statement, particularly as a healthcare professional right now. And I also want to say this is a very personal post. This isn't a professional post. So my new routine in the mornings is generally to read all the most recent advice released by Public Health England or my trust on the pandemic, which will inform my work that day at the hospital. But this morning I was a little bit distracted, and I was actually reading a book on quantum mechanics, and I came across this quote by the quantum physicist Niels Bohr. And he says that every great and deep difficulty bears within itself its own solution and forces us to change our perspective and our thinking to find that solution. And it kind of made me think, what kind of change in perspective are we needing to find the solution to COVID-19? And actually I was remembering that Niels Bohr is also someone who came up with this idea of contemporality. I think I'm hopefully pronouncing that right, which is the concept that you often have to have two seemingly contradictory theories to explain a particular phenomenon, particularly in quantum physics, such as the wave-particle duality of light. And I think that what that kind of tells us, if we extrapolate it further, is that we often need to hold seemingly mutually contradictory ideas to gain a more true picture of reality, and in particular to understand the human condition and to understand society. So it started me thinking, well, maybe to come closer to the solution to the corona pandemic, maybe we need to start holding the seemingly contradictory narratives and views and feelings of fear and fearlessness. So like as a healthcare professional, for example, we would wear personal protective equipment called PPE to reduce the spread between patients within the hospital, within a very vulnerable population within the hospital. And of course this is an evidence-based strategy that we use for many infectious diseases. So I would of course use PPE, but I wouldn't use PPE for the purpose of protecting myself. So I would be happy to contract coronavirus. I would be happy to become infected. I don't fear the morbidity, which is about 3.4%. So 3.4% of people my age, between the ages of 30 to 40, would likely be hospitalized and potentially put on an incubator. And I think the current mortality data is something like 0.08%. I would be of the personal opinion that this data is probably a significant overestimation because it doesn't include all the non-confirmed cases. But I don't have some sort of death wish. If this was an Ebola pandemic, I would be for sure wearing PPE to protect myself because it has a 50% mortality rate regardless of your age. And then of course once you're infected, you self-isolate for the duration of time that you're contagious, and then after that you develop immunity. And immunity is kind of your body's own natural personal protective equipment, at least for this year, we hope, and then life goes on, back onto the front lines as a healthcare worker. And then you become part of this reservoir of people who contribute to the herd immunity, which is likely to be important to preventing, I suppose, global spread in the long run. And in saying all of this, I am in no way suggesting that healthcare professionals or the general community should not take whatever strategies they feel they need to take to self-protect, self-isolate, so that they don't contract COVID-19. This is, of course, massively and totally valid and a really important approach. that we should be advocating for, particularly those who are high risk. But I think we really need to remain open to many valid approaches and strategies to this situation that are not necessarily contradictory. They may indeed complement each other. And I think controlled exposure to COVID-19 for healthcare workers or anyone in the community that wants to should totally be an option, who are happy with the risk and want to develop immunity. Yeah. And then I want to maybe explore fear a little bit more. I suppose, these questions of am I feeling fearful for other people, and do I feel fearful for the frail and multi-comorbid population who probably have more like a mortality rate of 8 to 9%? Do I feel fearful about the capacity of the healthcare system, the NHS, to meet the physical and emotional needs of the UK population during this time? Do I fear for the global south and the refugee camps? And I've tried to ask that question very deeply and very honestly, and I think the answer is no. No, I don't fear these things, and not because I think we're going to contain the spread. I have no idea what's going to happen. I don't. I think we'll just face the future as it comes, and not because I feel reassured maybe that the NHS has the capacity to meet the demands placed upon it. I don't know. I don't know whether that would be the case. I can't pass judgment on any of those things. But I don't fear these scenarios, and I think I don't fear them because I feel ready to meet them. And I don't think the solution to the COVID-19 pandemic lies only in public health prevention strategies such as social isolation and refining the National Health Emergency Service Delivery Plan. I think those are really important. I'm not saying that we shouldn't do those things. We should, and we are, I think. But I think it also lies in the individual and the collective ability to meet these difficulties with an open heart and without fear. And I don't fear this, probably partly because I feel willing to meet the grief and the sadness, either directly or vicariously, for the morbidity and the mortality and the challenges that will come with the COVID pandemic. Just as I feel willing to meet the sadness and the joy that comes when we open ourselves to the spectrum of the full human condition, which we find in the hospital every day at work and which we find in the wider world around us. I think we're only ever going to need both. And what I do fear is I fear fear itself. I do. Like that Franklin Roosevelt quote, in his inauguration speech: "First of all, let me assert my firm belief that the only thing we have to fear is fear itself. Nameless, unreasoning, and unjustified terror that paralyzes us and prevents us from advancing. And I fear the way in which fear can deplete us, and I can see that already in my colleagues around us, and prevent us from feeling compassion and from opening our hearts and from meeting the grief and the sadness, the ways in which it causes us to constrict and isolate. So what I really invite us to do is to hold multiple views, is to hold the perspective of fear. Fear is valid. I'm not saying it's invalid. It's completely valid. And we should be open about that, and we should be honest about that. But fearlessness, it's also valid. And we're going to need both. We're going to need to hold both perspectives to make sense of this situation. So that was my reflection.